Welcome back to Anatomy and Physiology. We are going to be covering the endocrine system today. So our focus for this is to identify the contributions of the endocrine system to homeostasis, or that balance in the body. We're going to discuss the chemical composition of hormones and the mechanisms of hormone action. We're going to summarize the site of production, regulation, and effects of the hormones of several of the different glands in the endocrine system. And then we're going to discuss several common diseases associated with the endocrine system. What is the system? It's made up of the glands that produce and secrete hormones. It helps to regulate growth, metabolism, and sexual development. It responds to stress and injury. And it works to maintain homeostasis. So the overall big idea of the endocrine system is it is a messaging system. You have hormones, and these hormones are chemical messengers that are secreted by one of the glands. They then typically enter the bloodstream, where they travel to a specific target cell with the receptor that they match. And that completes your message. So your major structures are going to be the glands. So in your brain, you have your pineal gland, your hypothalamus, and your pituitary. In the throat area, you have the thyroid and the parathyroid. Above your heart, you have your thymus. Above your kidneys, you have your adrenal glands. Under your stomach is the pancreas. And then in the lower abdomen and groin area, depending on sex, is either ovaries or testes. There are two main ways secretions occur that we've talked about before. You have endocrine, which are secretions inside of the body, which is what most hormones are going to be. And then exocrine, which are secretions outside of the body, like sweat. So the endocrine types, you have merocrine, which you have little vesicles that go up to the edge and get released out. You have apocrine, where pieces are pinched off and sent out. And then you have holocrine, where they just kind of expand out, and this would be like sweat. So what do the hormones do? Most of them are going to be somewhat of a negative feedback system if they are trying to maintain homeostasis. So think of this like the thermostat in your house. It's set at whatever temperature you have it at. And if it's wintertime and you have it set at 75 degrees and the temperature in your house drops to 72, the thermostat registers, okay, it's below where it's supposed to be, turn on the heater and heat the house back up to where it's supposed to be. Or opposite in the summer, where it's set at 75 degrees and it's 80 degrees in your house, so it's too warm. The AC kicks on, bringing it back down to where it's supposed to be. That is a negative feedback system or loop. It's a teeter-totter, where if it gets out of balance, you push on the other side to make it get back into balance. We've talked about these before when we talked about insulin and sugar levels, blood sugar levels. So the point of this is to remain in balance if it's a negative feedback. If it goes up, it has to come back down. If it goes down, it has to come back up. So another example is calcium regulation by the thyroid and parathyroid. So if your calcium level rises above a set point, the thyroid gland releases calcitonin, and that calcitonin causes the blood calcium levels to fall. And if your calcium is low, if it falls below the set point, the parathyroid gland releases parathyroid hormone, and that causes your blood calcium level to rise. We talked about this when we talked about the skeletal system. If you have too much calcium, your body flushes it out typically with your urine. If you don't have enough, it can pull it from your bones. Another example, we've talked about this one several times, your glucose levels or blood sugar levels. So let's say you eat some food, your blood sugar goes up, your pancreas will then release insulin, and then that will cause your blood sugar to lower. If your blood sugar is low, your pancreas causes your liver to release glucagon and glucose, which causes your blood sugar level to rise. So basically the pancreas works with the liver and uses insulin and glucagon hormones to either increase or decrease your blood sugar level to where it needs to be. Somebody with diabetes, we'll talk about this later, can't control that. Now, there are very few examples of positive feedback systems in the human body because normally our bodies want to maintain that homeostasis. It wants to stay in balance. But an example of a positive feedback system or loop would be contractions during labor. They start off very weak and then they just keep getting stronger and stronger. So the brain stimulates the pituitary gland to secrete oxytocin. The oxytocin is carried in the bloodstream to the uterus. The oxytocin stimulates uterine contractions and pushes the baby towards the cervix. The head of the baby pushes against the cervix, the nerve impulse from the cervix is transmitted to the brain, baby's not out yet, and it increases the release of oxytocin, and this just keeps getting higher and higher until eventually the baby comes out. And this will continue until the baby and the entire placenta come out, and that basically kind of tells the system, okay, it's all gone, we don't need to keep secreting oxytocin, and then it will go back to normal levels. But until the baby comes out, those contractions keep getting stronger and stronger until the baby comes out. So the pituitary gland is located right here below the brain. So hormone control. The pituitary gland is often called your master gland. It controls all the other glands, so it's the boss. Its actions are controlled by the hypothalamus in the brain that we talked about when we talked about the nervous system. So it is the master gland of the endocrine system, so it tells all the other ones what to do. So some hormones from the pituitary gland. You have prolactin, or PRL. It stimulates milk production after a woman's given birth. It can affect other levels as well, from the ovaries in a woman and the testes in men. So even though men don't a lot of times produce these hormones, they can have an effect on them because their bodies still do have receptors for them. So if a person is trying to, say, transition from male to female, there are drugs that are able to be used to increase the production of this hormone, which can stimulate breast growth or other things to help with that transition. A common one you hear about a lot, another hormone, is HGH, or human growth hormone, just growth hormone here. It stimulates growth in childhood. It's important for maintaining a healthy body composition. So if for some reason a child is not developing as they should, they can give them human growth hormone to help them develop, especially if it's somebody who is like 16, 17 and their body isn't developing like it should. It's also very important as you get older for maintaining muscle mass and bone mass. So that's where you run into issues in professional sports where people like to use HGH to help build and maintain their muscle mass, which is basically doping and very much illegal in sports. It also can affect where fat is found on the body as well. Myostatin inhibits muscle growth. So it's kind of the opposite of your human growth hormone that increases muscle growth. The myostatin stops that muscle growth. So there are myostatin inhibitor drugs that are being developed with the intent of treating muscle wasting disease, like muscular dystrophy in humans, where basically the muscles just start to waste away and they aren't able to grow. So if you stop that myostatin from breaking down or inhibiting those muscles from being developed, hopefully by not allowing muscle growth to not be stopped, it sounds very weird when you word it, but basically it would hopefully allow them to continue to grow the muscles and limit the effects of muscular dystrophy. What you see here is a Belgian blue breed bull, and it has a genetic anomaly that suppresses the production of myostatin. That's why when you look at it, you see all of the muscles. It is very muscular because it's not inhibiting that muscle growth. So, when we look at the images here, you have a wild type mouse and a mouse that has been given a drug to suppress the myostatin. And you can see the difference in just size. And then after they had died and you skin them, you can see definite differences in the muscle development. So, would this be a negative or positive feedback system, myostatin and growth hormones? I want you guys to think about that. And then, would there be a disadvantage to growing muscles really quickly? I mean, a lot of people want to be able to bulk up and build muscles really quickly. So, would it be a good thing to block the myostatin and allow this to happen? So, some problems with the pituitary gland, if it does not act correctly in regulating the myostatin or the growth hormone, you can end up with different things that go wrong. For instance, dwarfism, where obviously dwarfism, people are not growing to the height of an average human. And then on the opposite end, you can also have people who grow too much. This person was known as Alton the Giant. He was 8'11", so almost 9 foot tall. Obviously, this picture is probably better for proportion-wise than this one because of the angle, but he was very tall. And typically, if you are experiencing either dwarfism or this example of giantinism, you end up with a lot of medical problems. There are a lot of medical problems associated with both ends of the spectrum. You're better off being in the middle. It's kind of like with dog breeds. Some of the really big dog breeds like Great Danes and some of the really small ones like toy poodles have medical issues because of the extremities that they're at. Whereas a mutt or a crossbreed of something that you don't really have a specific breed for because there's just so much mixed in actually tends to be healthier because it's somewhere in that middle and you're not getting these extremes that can cause problems. Next we have ACTH, adrenocorticotropin. It stimulates the production of cortisol by the adrenal glands. So cortisol is a so-called stress hormone. It's vital to your survival, and it helps maintain blood pressure and glucose levels. There have been a lot of diet ads claiming that they block cortisol levels, and that cortisol from stress may lead to fat deposits in the belly. I mean, whether this is accurate or not is up for debate, but a lot of diet aids make these claims, but they don't really do much to help. If anything, they might actually hurt the balance of your body, because if you take your body out of balance, it can cause a lot more problems. Next, we have one associated with the thyroid. It's the thyroid stimulating hormone, pretty easy to remember, or TSH. It stimulates the thyroid gland to make thyroid hormones. Go figure. Thyroid stimulating hormone tells the thyroid you need to make your hormones. Comes from the pituitary gland telling the thyroid do your job. And the thyroid in turn will help to regulate the metabolism, energy, growth and development, and nervous system of the body. So a lot of times if somebody has a thyroid issue, when they do blood work, they look at the TSH levels and then another hormone that I believe we will be talking about called T4 to see is the problem the thyroid is not making the hormones properly. Like if there's a bunch of TSH saying, hey, make your stuff, but there's not a lot of what it makes, which is the T4, then the problem is the thyroid. But if there's not a lot of TSH and not a lot of T4, so both levels are low, that means you need more TSH. So the pituitary gland needs to send more. So the difference being, think of it like a chain of command. You have your person at the top telling you what to do. You have your boss, and then you have the shift manager, and then you. If your boss is telling your shift manager to tell you to do something and they're not telling you, you can't do it. But if the boss isn't telling the shift manager to tell you to do something, then nobody knows what to do. Next, we have luteinizing hormone, or LH. This regulates testosterone in men and estrogen in women. Sometimes also referred to as gonadotropin as well. And these affect your testosterone and estrogen and also progesterone levels in women and men. So the next one we're going to talk about is follicle stimulating hormone, or FSH. It promotes sperm production in men and stimulates the ovaries to release eggs in women. So both of those last two work together to allow for a normal function of the ovaries or testes. If a woman is having difficulty becoming pregnant, they may use injections of follicle stimulating hormones to cause more eggs to release, or if they're going to have their eggs frozen, to once again cause more of those eggs to release so that way they can save them for later use. So that is sometimes how you can end up with multiple births, like the Octomom here, who had 8 babies at one time. Next, the posterior pituitary hormone. So we're moving to the other part of the pituitary gland. You have oxytocin. Oxytocin, once again, causes milk in nursing mothers and contractions during childbirth. Pitocin is another controversial topic in childbearing. Oxytocin is a natural hormone produced by a woman's body that causes the contractions. Pitocin is a synthetic form of this. So Pitocin is what is used to induce labor and to sometimes speed up labor. So when somebody is scheduled to give birth or be induced, they will give them Pitocin to induce labor, hopefully. Or if the labor process is going on for an extremely long period of time and they want to try for a non-C-section birth, they will use Pitocin to hopefully speed along that process to get the uterus to open up and allow the baby to come out. The next hormone that the pituitary gland will produce is an antidiuretic hormone, or ADH. It's also called a vasopressin. It's stored in the back part of the pituitary gland and it regulates water balance. So really what it does, a diuretic can make you urinate a bunch. An antidiuretic helps to stop you from urinating too much. So if you urinate too much, it can lead to dehydration. Go figure. You're getting rid of too much water. So when the body is dehydrated, the ADH will kick in and cause the kidneys to say, hey, yeah, no, we're keeping this water. We can't get rid of it. We need it. So some hormones in action. So why do you feel thirsty? Well, your body is registering that you do not have enough water. So it's dropped below normal. So the hypothalamus detects there, it looks at your blood and it's like, there's not enough water in here. We have too many things dissolved in the blood. We need more water. So two things happen. The hypothalamus creates feelings of thirst, and it also tells the pituitary to release more ADH. So the person then will drink water. The ADH stimulates the kidneys to reabsorb more of the water as well. So those are the two effects that happen. The ADH causes the kidneys to absorb more water, and the person drinks water because they feel thirsty. Now, if you have too much water, the hypothalamus detects low solute concentration, so there's not as much dissolved in the blood and there's too much water. So the pituitary gland will release less of that ADH, which tells the kidneys to don't absorb as much water, and then you need to go pee. Diuretics, as I mentioned, increase urine production. Many common foods and drinks contain chemicals that are diuretics. Alcohol is a very common one. As you get older, you may experience that if somebody drinks alcohol, then they typically have to pee a lot. Another example are some sodas like Mountain Dew is another common diuretic. You drink too much Mountain Dew, it makes you have to go pee. So, a common example of a kind of over-the-counter drug that is a diuretic, it has other things as well, but Midol. It relieves bloating because it contains a diuretic that basically makes you have to pee more. When you're bloated, you're retaining water, so if you pee more, you get rid of that bloated feeling because you're getting rid of the water. So in Midol, you have acetaminophen that helps with a pain reliever, whether that be headaches or cramps. It has caffeine, which is a diuretic, which relates back to the Mountain Dew thing. Also, coffee, things like that. Anything with a lot of caffeine can be a diuretic. And then pyramidine malate is also another diuretic. So whenever you are looking at some sort of medicine, look at the active ingredients. They typically try to tell you what they do a lot of the times. But now if you see the word diuretic, it'll be like, oh, okay, so that makes me have to pee. And now that you also know that caffeine can be a diuretic, if I'm drinking a lot of soda, I may have to go to the bathroom more often. Moving on to the thyroid gland. So the thyroid hormones control your metabolism, which is the body's ability to break down food and store it as energy and release energy. So I mentioned the T4, which is called thyroxine, and then you also have another one called triiodothyronine. I probably butchered that name and I apologize. They both increase the rate at which cells release energy from carbohydrates. The reason why I know the TSH, the thyroid stimulating hormone from the pituitary gland, and then the thyroxine from the T4 is I have family members who have had thyroid issues and have been on a supplement to help with that. And so I looked into it to figure out kind of when you look at your blood work, what are they looking at? And that's how I learned that if both are low, the pituitary gland's the problem because the pituitary is not releasing enough of the TSH. But if the TSH is high and the T4 is low, that means the problem's in the thyroid because the thyroid is being told what to do, but it's not actually able to do what it's supposed to. So a lot of times in blood work, they will measure both if they're looking at a thyroid problem to see which is the cause. Is it the pituitary gland or the thyroid causing the problems? And then calcitonin, it regulates the blood concentration of calcium, as we mentioned before. Your body is set at what is known as the BMR, or basal metabolic rate. It's how many calories the body must consume to maintain life. So for most humans, that average is around 1,500 to 2,000 calories a day. And that is, you can, when I post this, you can go to the BMR calculator and kind of figure out what your level is. But overall, the basal metabolic rate is pretty consistent. It can change if you change your diet extremely or things like that, but normally it is pretty consistent. So, problems with the thyroid. Iodine is essential for the formation of that thyroxine, that T4. And a lack of iodine causes a swelling of the thyroid known as goiter. A lot of people get their iodine from iodinized salt. Prior to salt being iodinized, a lot of people wouldn't get enough iodine and there would be a lot of cases of goiter. But salt, they found that salt they could add in the iodine and it didn't affect taste, it didn't do anything. But people were now getting adequate levels of iodine, and so cases of goiter went down. So iodinized salt is not more dangerous than regular salt. It's actually better for you than regular salt because it's giving you that extra essential vitamin or mineral that you need. The essential nutrient, iodine, that you don't get in a lot of other places. So it's not a big deal to use iodinized salt. It doesn't really affect anything. So this is what goiter looks like if you are not getting enough iodine. And it causes that thyroid on your neck to swell. And so, yeah, that's not something you want. So easy enough to avoid by making sure you get proper nutrients. Hypothyroidism. Hypo, once again, means low. So this means their thyroid is not producing enough, which means a lot of times their metabolism is lower, meaning that they aren't able to process foods and nutrients as well. And what that leads to is a lot of times people being overweight. So if somebody is experiencing hypothyroidism and they realize what's going on, they go to a doctor, and then the doctor helps them to fix this, then they can actually lose weight, and it can also fix their hair, nails, things like that. So you can see the difference of the before and after picture for each person here. You can also have it happen in infants where you have other issues as well. Now you can go to the other extreme and have hyperthyroidism where it's going too much, also known as Graves' disease. It can cause the enlargement of the thyroid and other symptoms like exophthalmos, heat intolerance, and anxiety. You have here a normal thyroid in the pink and the enlarged one in this blue color. If you get exposed to radioactive iodine in childhood, it can cause thyroid cancer. This was a big thing with Chernobyl because the nuclear power plant that exploded there released a lot of radioactive iodine. And there have been a lot of cases of people with thyroid cancer from that area, especially with the younger children. So the younger you are when you're exposed, the more likely it is to have an effect on you as you get older. And this was one of the big concerns with the Fukushima nuclear meltdown that occurred less than a decade ago in Japan. Due to the tsunamis that hit, it caused one of the reactors to melt down because it couldn't get properly cooled. And it released, they had to release some of that iodine into the atmosphere. They tried to mitigate and get people away so that way they would hopefully not have as much exposure and keep them from getting thyroid cancer in the future. Next is the parathyroid gland. It is located on kind of behind the thyroid. They're right here, little bitty kind of bulbs on the thyroid gland. There are 4 little tiny glands. It takes the calcium from the bones and makes it available in the blood. That's kind of what they do. Next, the adrenal glands. The adrenal glands sit on top of your kidneys. You have the outer cortex and the inner area. So the adrenal cortex and the adrenal medulla, outer, inner. They produce, as their name implies, adrenaline. So the adrenal medulla can help make epinephrine and norepinephrine. These increase your heart rate and breathing rate and elevate your blood pressure. These are what are released in your fight or flight response to stress. People with some severe allergies carry injector pens, EpiPens. They contain epinephrine. Because what happens when you have a severe allergy is your throat starts to swell like this person's hand here, and when your throat swells, it closes and you can't breathe. So the epinephrine works to increase your heart rate, it works to help reduce the swelling and all these things to help basically get you through that reaction. And if you ever have to use an EpiPen, you need to also make sure you go to the ER as well. So a big thing has happened with EpiPens. They're called epinephrine autoinjectors or EpiPens. They're used to treat allergic reactions. These are life-saving medical devices. And it has seen its price rise from $57 in 2007 to about $500, probably more now. The cost to make an EpiPen is about $1. Costs $1 to make, we're selling them for over $500. I don't know about you, but for me, I feel like that is a little more than ridiculous. So I want you guys to think about, do you think the government should enact laws to control prices of drugs, especially here in the US with our not the greatest healthcare system? There are a lot of people, especially if they live on the border to another country, so Canada or Mexico, will a lot of times cross the border to get their medications because they get them a lot cheaper. Because governments do regulate the prices. So that's just something to think about. Should the government enact laws to control these prices to keep people from having to choose between, do I get an EpiPen that could save my life, or do I pay my rent this month so I'm not homeless? These are choices that everyday people have to make because drug manufacturers have set prices so incredibly high and insurance companies are not always covering as much of the cost as they can or should. So the adrenal cortex, the other part, it makes aldosterone, which helps your kidneys conserve sodium and excrete potassium, maintaining blood pressure, so it helps maintain levels. Cortisol, which keeps the blood glucose level stable and is made in response to stress. And then adrenal sex hormone, you get androgens in males and estrogens in females. So an adrenal gland disorder, a common one actually in pets is called Cushing's disease, which is hyperadrenal corticocism. My pronunciation is not doing the best today, so I apologize again. With Cushing's disease, you see increased thirst and urination, increased hunger, increased panting. They tend to be more pot-bellied, so they look like they're bigger, especially in that stomach area. They tend to be more obese, and they can lose hair. Cushing's syndrome happens when the adrenal glands make too much cortisol, so they're making too much of that. So once again, hyper means high, so it's making too much. In humans, when you don't have enough cortisol, you can end up with something called Addison's disease. So this results in low blood pressure and can result in increased pigmentation. There are other things that are associated with Addison's disease that can occur as well. Moving on to the pancreas. The pancreas is a large gland behind the stomach. It helps maintain healthy blood sugar or glucose levels. It contains islands, quote unquote islands, of cells called the isolates of Langerhans, which secrete glucagon and insulin, which help to regulate that blood sugar level. Glucagon stimulates the liver to break down glycogen and raises your blood sugar. Insulin decreases blood sugar concentrations and affects the uptake of glucose by the cells. Both hormones have to work together to maintain that balance. So once again, here's that image. You eat something, you have too much, your pancreas releases insulin, and then the liver either takes up the blood sugar or you release it in urine and it gets back to a normal level. If you don't have enough, you detect low blood sugar, your pancreas releases glucagon. The glucagon goes to the liver, tells the liver, hey, we need more glucose, so that causes the liver to release glucose, raising the blood sugar level. Diabetes, you have a few different types. Diabetes mellitus results from an insulin deficiency. This causes the blood sugar to rise. It's called hyperglycemia, hyper, too much, and the excess is excreted in the urine. There are two types of full-on diabetes. Type 1 is known as juvenile diabetes or insulin-dependent diabetes mellitus, just commonly called type 1 or type 2, so type 1 juvenile diabetes. This is typically when there are cells, the pancreatic cells can't make insulin. So it's not caused by external factors, it's all internal, it's an immune disorder, and it's something that just happens. The body is not able to make insulin, so typically these children end up on insulin replacements. A lot of them will have insulin pumps, which are connected directly into them, like into their side, where they're able to regulate it with a little control and say, okay, as they get older, they're able to do this themselves. But it's like, okay, I ate this, so I need this much insulin to offset it. And they typically carry around ways to check their blood sugar and things like that. Type 2 is mature onset diabetes. It's usually after the age of 40. Often individuals are going to be overweight, and this type can sometimes be controlled with diet and exercise. Basically, when you're overweight, the body can't process things as well, and so to test for this, whether it's type 1 or type 2, you do a blood sugar test, which is you have a little pin-like device here that you take, you stabs your finger, you squeeze out some blood, and then you put it on a meter and it registers how much blood you need, how much your blood sugar is at, and how much insulin you need to help to offset it. Hypoglycemia can occur if your blood sugar levels are too low and can be cured with direct injection of glucose or with eating something high in sugar. That's why diabetics often carry around like hard candy. Also, if it's a younger kid, if they can't eat or drink, then definitely call a hospital or an emergency room. But if they are having low blood sugar, a piece of hard candy, some sugary fruit juice, something like that, that will help to increase their sugar levels. Diabetes insipidus is an uncommon condition that occurs when the kidneys are unable to conserve the water as they perform their functions of filtering blood. So the amount of water conserved is controlled, as we said, by the ADH, and the ADH hormone is produced in a region called the hypothalamus. Some symptoms of this can be excessive thirst, because if you're obviously not able to conserve your water, you're going to be thirsty all the time. And it involves cravings for water or ice. Gestational diabetes. Gestational is referring to when somebody's pregnant. So pregnancy hormones can block insulin from doing what it's supposed to, and when this happens, you can end up with high glucose levels that may increase during a woman's pregnancy. Gestational diabetes usually starts about halfway through the pregnancy. All pregnant women should receive an oral glucose tolerance test between their 24th and 28th week of pregnancy to screen for the condition, and once the baby is born, the condition typically resolves itself. If diabetes is not treated properly, you can end up with diabetic neuropathies. They're a family of nerve disorders caused by diabetes. People with diabetes can develop this nerve damage throughout the body. A lot of times you do see issues with the feet, and you get wounds that don't heal very well. Symptoms include pain, tingling, or numbness or loss of feeling in the hands, arms, legs, or feet, and wounds that just don't heal. Other endocrine glands. Your pineal gland. It's located between the cerebral hemispheres of your brain. It secretes your melatonin. It helps maintain your circadian rhythms or light and dark activities, kind of like your sleep cycle. You have your thymus gland. It's large in young children, and as they get older, it shrinks. It secretes thymosins, which are important to help your immune system. Your reproductive glands, your testes and your ovaries. You have testosterone, which are in men, and then progesterone and estrogen, which are in women. So gonadotropins include any hormone that affects the gonads. So all of these are gonadotropins because they affect the gonads or ovaries or testes. Now, just because we typically associate testosterone with male and progesterone and estrogen with female does not mean that they can't occur in both. So women do have small levels or low levels of testosterone, and men have low levels of estrogen and progesterone. But typically they're kind of running even until you hit puberty, where for men your testosterone gets ramped up, and for women the estrogen and progesterone get ramped up. Steroids. Steroids are another type of hormone. Anabolic steroids are artificially produced hormones. They are the same as or similar to androgens, the hormones in the body. There are more than 100 variations of anabolic steroids. The most powerful androgen is testosterone. You also have corticosteroids, which are used to reduce inflammation and that can result from injury or allergic reaction. These ones are available by prescription. So if you have an inhaler, it probably has a corticosteroid of some sort in it. If you have some types of immune disorders, like colitis, they will sometimes prescribe a corticosteroid to help reduce inflammation. So with colitis, depending on what it has, you may have severe diarrhea, and the corticosteroid actually reduces the inflammation so your body no longer goes through that. There are going to be a couple of assignments, one that goes right along with the notes, and then an article as well for you to complete at the website. If you have any questions, please reach out to me. And this is our whole kind of mini unit over the endocrine system. So there's a lot of information here. I know. Just do your best with it. If you have questions, please, please, please email me, and I will get back to you as soon as I can.